Good morning, everyone. My name is Rachel Schneider. I'm a third-year medical student at the UMass University Chan School of Medicine. I have no financial disclosures to report. So for background, perforated peptic ulcer disease has a low prevalence but a high mortality, and up to 50% of patients that have perforated peptic ulcer disease undergo exploratory laparotomy. Transfer patients in general, regardless of the type of surgery, have been shown to have an increased length of stay, and transfer to higher level of care often occurs due to limited surgical coverage or hospital resources. Our study was a single institution study with patients from 2018 to 2021 who underwent exploratory laparotomy for perforated peptic ulcer disease. And we aim to look at the differences in risk factors and outcomes for transfer patients versus non-transfer patients. We used Epic Report Workbench, which is part of our electronic medical system, and we identified 27 patients between 2018 and 2021 who had an exploratory laparotomy for perforated peptic ulcer disease. This is what the Epic Report Workbench looks like when you run a report. And as you can see, we can determine which variables we'd like to be included in the report, such as length of stay or diagnosis codes. After we generated the report, we scrubbed the data to only include ICD codes for PPUD, and then we manually reviewed the charts of the patients receiving exploratory laparotomy. We checked each patient chart for transfer status and verified the accuracy of the report, and then we analyzed transfer versus non-transfer patients. And we found that transfer patients had significantly longer length of stay. This is our Table 1 discussing the demographics of our patient population, including age, sex, marital status, race, and ADI, both national and statewide, which is the Area of Deprivation Index. As you can see, the ADI for state for most of our patients is in the higher deciles, which indicates a higher degree of socioeconomic deprivation. This is our Table 2 detailing the clinical outcomes for patients, including length of stay, the necessity of ICU care, status on discharge, and readmissions. As you can see, the length of stay was significantly different between the two groups. The average length of stay for transfer patients was around 41 days, and for non-transfer patients was only about 20 days. This is our Table 3 discussing clinical comorbidities for our patients, including alcohol use disorder, tobacco use, Charlson risk score, Apache risk score, and HCC score, which is a CMS estimation of medical complexity based on patient demographics and diagnoses. We found HCC score to be significantly different between transfer patients and non-transfer patients. As you can see here, transfer patients had an average HCC score of 0.048, and non-transfer patients had an HCC score of around 0.09, which may indicate that transfer patients could be more medically complex. So to summarize our results, we had 27 patients. The length of stay was around 20 days for non-transfer patients and 41 days for transferred patients. The average HCC score was also significantly different between the two groups. And of note, although this was not statistically significant, 83% of our non-transfer patients required ICU admission, and 100% of our transfer patients required ICU admission. Our study definitely has limitations. One is that it's very low powered, being a single institution study with a fairly rare condition and surgery. Additionally, EPIC reporting requires the accurate coding of diagnosis codes and of procedure codes. So we could have missed some patients in our report if their ICD codes were not recorded correctly. And additionally, we are a tertiary referral center, and so this may differ between different institutions. So national data on transfer patients would be useful to identify trends. So more investigation is needed to determine whether these patients had an increased length of stay due to their medical complexity, due to the transfer itself, or a combination of the two, and further inquiry to identify modifiable variables to facilitate the care of transfer patients is warranted. I'll pause for questions.